I'm Cynthia Anderson, and I'm a radiation oncologist, and I've been with Frog for 3 years. The importance of educating women about their health is about knowing things that they should look out for, symptoms that they should be alerted to let them know that something might not be feeling right. Sometimes women may have more of a tendency to ignore symptoms if they're not feeling well, but the important thing is that we don't want to let them get behind on any of their checkups or any of their cancer screening because we want to keep them healthy. One thing that I would say is important for women to remember that when it comes to cancer, the #1 cancer killer for women is still not breast cancer, it's lung cancer. And it's actually the #1 cancer killer in both men and women. And last year, in 2011, it was a big breakthrough year in cancer because all cancers, all of the common cancers at least, are ones that we have regular screenings for. Breast cancer, prostate cancer, skin cancer, we have regular screenings for. We've never had a regular screening test be approved for patients if they have a history or risk factors for lung cancer. But last year we began to see that getting an annual or a regular CT scan, if you have a long-standing history of tobacco, can help catch lung cancer early. And so I want patients to continue to remember that the #1 cancer killer out there is still lung cancer, and if you have any kind of a history or exposure, or if you have any concerns about lung cancer, you want to get on that sooner. My advice for busy moms, as a busy mom myself, is to try to always make time for yourself. And that's really easy to say and sometimes hard to do, but the important thing to remember is that taking time for yourself, whether it's just to relax, whether it's to exercise, whether it's to see a doctor and get a checkup, whether it's to do something you enjoy, is not a selfish act, it's a selfless act. Because by doing things that help you take care of yourself, it gives you the strength to be that busy mom and take care of other people. There's not necessarily a direct correlation between heart health and cancer, but when it comes into importance is if a woman is diagnosed with cancer. And so if she is, then we need to make sure that she's strong enough to be able to go through, whether it's surgery, chemotherapy, or radiation therapy. So being heart healthy is not just important for her overall health, but it comes in handy in case she ever gets sick down the road. So it's important to remember that the #1 killer of women in America is not cancer, it's still heart disease. So being heart healthy is important overall. The recommended screenings for women for cancer prevention is that they still have a mammogram starting at the age of 45 or 10 years earlier than any relative in their family was diagnosed with cancer. So for example, if you have a sister who was diagnosed with breast cancer at the age of 50, you would want to start at the age of 40, 10 years earlier, and that's the same for any cancer. So a mammogram every year starting at the age of 45. You want to have a pap smear every year starting 2 years after initiation of sexual activity, and you will keep going with that until you're menopausal. You want to have a skin cancer check every year as part of your general physical screening, and you need to have your thyroid examined both by physical exam and by blood work once a year. Well, it's a big honor, and it's really wonderful for me to come back to work in the city that I grew up in. I've loved being a resident here in Jacksonville, and when I was growing up and getting educated here, and as I was coming back after going away to college, I just began to see how Jacksonville is a city about people who really love being here. And so I wanted to come back and be a part of a community that had done something for me. I wanted to be able to give back and do something for them. So the Pink Ribbon Symposium is a breast cancer educational awareness event that happens once a year, and we started it in 2007, and this year's going to be our 5th annual event, so we're very excited about that. And the reason I love to be a part of it so much is it gives me a chance to interact with the community. I get to interact with patients, family members in the community. I get to meet other healthcare providers who also are passionate about women's health, and it really becomes a great way to become connected, more connected to the patients and to their families, and more connected to other healthcare providers who help take care of our patients.